All right, so we're going to discuss some three things. All right, some three things as related to joint health. Okay, so this is what we're discussing is we're trying to talk about cartilage wear. We'll talk about intra articular fractures. That's like fractures within joints. Then we'll get to also talk about joint subluxation. All right, so these three things as related to joint health. Okay, so the first one we should be addressing is the concept of cartilage wear. All right, so wear is just like something is chopping off. You understand? Like something is chopping up. It's no longer smooth. It's losing its parts. So let's quickly have it. So cartilage wear is just gradual breakdown of the smooth cartilage that covers the end of bones in the joint. So normally the cartilage is smooth. You see a normal knee is smooth, but when it's wearing off, you see it actually becoming so rough and all of that. So there's lots of cushioning and frictionless movement leading to stiffness, pain, and sometimes bone on bone contacts. So the person will be having all those teeth and stuff. So common causes could be due to osteoarthritis, could be due to repetitive stress, could be due to aging, could be due to trauma. So the joint pain worsens with activity, okay, crepitus, and also reduced range of motion. Okay, then intra-articular intra-articular fracture is just simply there's a fracture and it's actually what's affecting down to the joint. Where another bone is kind of like connecting to another bone. So it's a fracture that extends into the joint space. It will now disrupt the articular surface. It damages the cartilage and the bone alignment, and it often leads to post-traumatic arthritis if not treated properly. So common causes is all those high energy trauma. For the fracture to travel from the bone down to the joint, it has to be something that is high, right? So there's a lot of severe pain, there's swelling, there's inability to move the joint. So management is often surgical fixation just to restore the joint congruity and prevent any long-term instability. Then subluxation is more of like something is like sliding away from the place that it's supposed to be. I don't know if you understand. It will slide away, but if you now come to a particular position to slide back, So joint subluxation is just partial dislocation, just like I was telling you guys. The bones will lose their normal alignment, but not completely. So there's a way if you arrange it, they will still attain their alignment again, So it causes instability, abnormal motion. There's a risk of further damage to ligament and cartilage. So it could be due to trauma, could be due to ligament laxity, could be due to connective tissue disorders, So it causes a lot of pain, causes a lot of swelling, and the person actually feel as if their joint is giving away, all right, and there's reduced function, all right. So I think for these three concepts as related to joint health, I think this is what they mean: cartilage wear, intra-articular fractures, and also joint subluxation.